This is Amos. Amos lives in a village in Tanzania where mosquitoes rule the night, and every man, woman, and child is at risk of malaria. This is Charles. Charles works with Compassion Tanzania.
Malaria is one of the major killer diseases in this country, and those who suffer most are the children.
This is Jordan. When she was 14, Jordan went to Africa to visit the girls her family sponsors through Compassion.
We slept under a giant net. I thought, if we have one in a hotel, everyone in Africa will probably have one. We drove around the next day around the slums. Not one person had a net.
As much as mosquito nets can be cheap, still these families cannot afford to buy treated mosquitoes.
Malaria kills more than 1 million people each year. Malaria kills more people in Africa than HIV/AIDS, which is just crazy because malaria is preventable and treatable. So, who are these people who die from a preventable, treatable disease?
It only kills the poor kids, the kids living in the slums.
They live in a single room.
Ventilation is not enough. The rooms are mostly dark, which is an environment liked by mosquitoes.
You find that there is always stagnant water around their houses.
And then there's treatment. Poor people can't afford the cost of treatment when they get sick. Malaria mimics the flu when it starts, and suddenly, it's too late.
The child of my neighbor, she was suffering from malaria. They late to take him to hospital, and when they go to the hospital, it was late. That child was died.
I feel very bad when I hear of a case of a child who has died of malaria. Because malaria is preventable, it can be eradicated, we can do away with malaria.
That's what Compassion's Malaria Intervention Program is all about. In March 2007, 1 month before the interventions began, 26 students from this project were hospitalized. 12 were treated for malaria. In April, when Compassion trained parents in malaria prevention and distributed mosquito nets, 15 children were hospitalized. Only 4 were treated for malaria. In June, 5 were treated for malaria, and in October, just 4. And so it's been since the interventions began. Most everyone knows about mosquito nets. Compassion Tanzania is taking prevention one step further with cutting-edge research that uses trees to deter mosquitoes.
The nets are step one, but they're also working on mosquito-repellent trees.
This spray has been effective in reducing the population of mosquitoes in the area and has affected the reduction of malaria disease.
Now Amos is protected by a mosquito net indoors and the mosquito-repellent trees his mother planted outdoors. If the trees keep producing the results they showed in early testing, they will become another weapon in the global fight against malaria.
A lot of things have changed since I've come back. I've changed, and I wouldn't say I lived shallow before, but I'm definitely living deeper now. I've made brochures and told all my friends about it, encouraged them to give money or at least pray about it or learn about it more. And for me, it's just letting people know you can help end a disease. It doesn't take hours and hours of time. It's a $10 net.
$10 pays for prevention tools like the mosquito net, for parent education, and if a child becomes infected, rapid medical treatment.
We can't just sit back and wait for someone to fix this. We are the someones who need to fix this.
Now I think it is our duty to continue giving health education without despairing.
I think everyone, if is educated and do their part, we can do away with malaria.
For people in Africa, it's already hard. Malaria shouldn't be another thing for them to worry about.
For $10, we can check malaria off the list. For $10, why wouldn't we? Malaria bites. Buy a net. Save a life. Bite back.